is WCPO 9 News.
Thank you for joining us. I'm Julie O'Neill. Here's a look at some of the day's top stories. Ohio, Kentucky, and Indiana are all lowering the age requirements to get the COVID shots. This as Ohio receives the largest shipment of shots to date. As of today, Ohio residents 16 and older are eligible to get the vaccine. But remember, 16 and 7-year-olds can only get the Pfizer vaccine because Johnson & Johnson and Moderna vaccines are only approved for people 18 and older. In Kentucky today, people 40 and older are eligible for a shot. Governor Beshear wants those 16 and up to be able to get the vaccine as of April 12th. And new today, Indiana opened vaccinations to all Hoosiers 30 and older. On Wednesday, Indiana again lowers the age requirement. It'll be 16 and up in Indiana. Flags are at half-staff across the tri-state today as people are mourning the death of local business leader Ralph Dries. He was 86. Ralph Dries led the home building firm Dries Homes before entering politics. He was a Kenton County judge executive. In a statement, Senator Mitch McConnell said, quote, "The impact of Ralph's leadership and generosity can be seen throughout northern Kentucky. We're grateful for everything he did for Kentucky." The Millennium Hotel is starting to come down today. It will take more than a year to take the high-rise down piece by piece. Imploding the building is out of the question given its close proximity to other buildings. Elm Street will be closed between 5th and 6th Streets near the Duke Energy Convention Center for a long time. There is no confirmation on any replacement hotel as of yet. Jennifer.
Today we'll continue to see plenty of sunshine for the afternoon hours and a high 57 degrees. It's a normal spring day. Like this is what we should be looking at in late March. And the deal gets a little better tomorrow, only down to 42 for tonight with a clear sky, wind shifting to the south, and tomorrow will pop up to the 70-degree mark. It'll be mostly sunny, a little windy out there, but coming up, the return of rain and what that means for temperatures, especially as we roll into Reds opening day.
March 12th on this shot. Kelly Neese broke the all-time scoring record for Simon Kenton boys basketball.
It's been my whole life, really, all 5 years that I've been here.
But Kelly is still number 2 in his family for career points. That's video from 2016, a game winner from Kelly's older sister, Allie, on the same night she reached 2,000 career points.
Having your sister play and be the big star, I guess you could say, it was really cool to look up to her and see what she could do here.
Neither sibling, though, had an easy road to get there. Do you remember the night your sister got hurt?
Oh yeah, it was in a scrimmage in summer, down here on the block down there.
My left leg went backwards, popped out of place, and then popped back into place.
We were sitting up there in the corner, and my mom yelled.
And then I remember thinking in my mind, like, I didn't tear my ACL. There's no way I tore my ACL.
Allie didn't just tear her ACL, she also tore her MCL and meniscus.
You get a sickening feeling as when you evaluate an injury like that, and you know what it could mean for that athlete.
Allie had surgery and quickly began rehab.
Rehab itself was I think it was more mentally hard than physically.
Remarkably, she was able to make it back on the court by the end of her senior season. And now, she plays basketball at Northern Kentucky University. But unfortunately, that was not the last time Nick Repko would see a Neese sibling walk into his office.
Oh no. You know, my first thought was, not again.
I'll never forget that at all. I mean, I could tell when I did it that something really bad happened.
In the offseason before his junior year, Kelly tore his ACL.
Seeing her go through that recovery before really helped me, but seeing her go through that and then me go through that, she really led the path for me to do that.
Well, he's also kind of competitive, so he would be like, hey, if Allie can do it, I can do it.
And he did. He recovered, and not even 2 years later, Kelly is now the leading scorer in program history and just broke the single game scoring record too with 47 points in one game.
It just taught me to not take anything for granted.
I want things to just stack up for him so finally he can be like, okay, all that was worth it, because he's been through a lot.
In Northern Kentucky, Caleb No, WCPO 9 Sports.
I'm real old, man. Ronald William jokes all the time, but at 65, he and fellow home health care worker Natalie Johnson.
I missed my last year's birthday. I spent it in the house by myself, cooked my own dinner. This year I want to be out somewhere and I want somebody to cook for me.
Have simple dreams the vaccine they almost skipped might bring to life.
I was scared because of what they say the side effects are. We don't get the same type of health care as everybody else. One time I was in the hospital, couldn't even hardly stand, and every time I stood, I passed out, but I still got sent home.
It's too much history of disparities. I've experienced it firsthand. I'm a veteran. I was a medical specialist in the Army. There's a particular hospital that I go to. I'm not going to make reference to the name. I went in with an elevated temp. The nurse communicated, she tried to minimize. Oh, that's not an elevated temp. I said, wait a minute, man.
We have to find it in our hearts to step above. People are dying. I know probably 10 people who have passed. So I just was determined. I'm not going to let oppression stop me from taking care of my health. I'm just not going to do it.
Initially, I was hesitant, but I stayed in tune. I did my research, consulted with people, professionals, got feedback, facts. Then I had to proceed and come in.
The first location I came to, I was first in line that day. And I was there for like 2 hours, and long story short, they sent me home without it. They were all white. And I kept trying to be patient, but I felt some kind of way. You know, I'm like, I told the lady I was first in line and it's an hour later, why am I still here? And she kept telling me they couldn't find my paperwork, they couldn't find my paperwork. I was hurt. I left there with tears in my eyes, like, they don't even want to vaccinate me and all of this is going on. But I'm not going to let fear stop me. I'm going to fight through whatever I had to fight through to get to the other side.
Doors and room for both to get shots opened in Springdale. Right after getting second doses, this once skeptical pair left empowered and felt protected. Larry Seward, WCPO 9 News.
New details have been released on the origins of the coronavirus. A study by the World Health Organization and China found the transmission of the virus from bats to humans through another animal was the, quote, most likely scenario. That's according to a draft of the report obtained by the Associated Press today. The report also states a lab leak was, quote, extremely unlikely. The official report is expected to be released in the next few days. Summer camps have been deemed a safe place for kids this summer as long as proper protocols are followed. That's according to newly released guidance from the CDC. Face masks, social distancing, and frequent hand washing are the biggest recommendations from the agency. Starting today, Amazon workers can call a hotline to voice a complaint or concern about working conditions. The trade union Unite says workers need a place to speak up freely. A Unite spokesperson says workers have already voiced concerns about timed bathroom breaks, unrealistic production targets, and a high number of on-the-job injuries. Amazon defended its business practices by saying the company offers, quote, excellent pay, excellent benefits, and opportunities for career growth.
As the Biden administration races past its vaccination benchmarks, questions mount over if and how to use extra jabs as a form of diplomacy around the world.
We will obviously in the future have surplus vaccine, and there certainly is a consideration for making that vaccine available to countries that need it.
The U.S. has contracted millions more coronavirus vaccine doses than there are Americans. So far, the U.S. has agreed to share just 4 million vaccine doses with Canada and Mexico. And some experts say it will soon be time for the U.S. to step up its vaccine diplomacy.
Just on basic humanitarian grounds and as a trade-off in terms of foreign policy objectives, we can and should use these vaccines to accomplish those goals.
The agreement to loan vaccine doses to Mexico comes as the U.S. is seeking help to deal with a surge of migrants at the southern border. Both the U.S. and Mexico have denied that the vaccines were shared with any strings attached. Mexican officials told Newsy the deal was not made on a quid pro quo basis, saying the negotiations began almost 2 months ago during the first conversations between Presidents Lopez Obrador and Joe Biden. Meanwhile, some of America's top global competitors like Russia and China have been much more generous in shipping doses outside their borders. The Biden administration has said it wants to be a part of the global solution to the pandemic, but the White House doesn't want to make decisions about excess vaccine supply too soon.
There are obviously a number of factors, including the fact that these variants are unpredictable. We're still at war with the virus. We don't know which one is going to work best with children.
Though millions of Americans have yet to get the shot, the U.S. has contracted 300 million doses of AstraZeneca's vaccine. That has yet to get U.S. approval, making it the most likely choice to ship out to countries that have okayed the shot.
What the Biden administration is doing is a very good first step, but that's all it is. We're going to have so many excess doses of these coronavirus vaccines, and we should be doing more to get them out to countries that need them.
Kellen Howell, Washington.
Progressives on Capitol Hill are one step closer to getting rid of some federal abortion restrictions. Democratic members of the House and Senate introduced the EACH Act Thursday, a bill aimed at permanently doing away with the restrictions from the Hyde Amendment, a 1976 provision that keeps federal funds from providing abortions in most cases.
1 in 4 women who are low income seeking an abortion are forced to carry to term.
The rule applies to Medicaid recipients, the majority minorities.
Whatever you think about the procedure, we should all agree that what's legal for a wealthy American should not be so inaccessible for Americans of color and low-income Americans.
Hyde is a rider. It doesn't have to be a part of appropriations bills, but Congress has attached it for 40 years. Opponents could get rid of it by making sure it's not added to bills, or they could pass legislation that makes sure that government insurance covers abortions no matter what. Advocates got a temporary victory. The latest COVID relief package didn't include Hyde provisions. They praise the move, but want to see permanent action and guaranteed abortion coverage.
That was just one piece of legislation, and it really won't have a huge impact on people who are seeking an abortion and struggling to make ends meet.
The president supports the efforts, but Congress could be an uphill task for progressives. Polling on the issue depends on the question at hand. A 2021 Ipsos poll shows 58% who say health insurance should cover abortion, whether it's public or private. However, a 2021 Marist poll shows only 38% support taxpayer-funded abortions.
The Hyde Amendment is a sort of cornerstone common sense pro-life protection, and we will be fighting to make sure it's included in the next.
The House, it will need support of at least 10 Republicans and all Democrats in the Senate. Amber Strong, Northern Virginia.
The first COVID treatment trial in the world to include pregnant women was just launched. Now researchers need patients to enroll. They're studying a long-approved diabetes medicine, which they believe will be effective in keeping people out of the hospital and dying from COVID-19.
We need 570 people.
It's a specific number, and statisticians have carefully mapped out the percentages as to why that number works. 570 people need to enroll within 3 days of receiving a positive COVID test. Participants will either get a placebo or a diabetes drug called metformin.
Those analyses did find that people who had been on metformin before they got COVID-19 were less likely to be hospitalized or die than similar people who were not on metformin.
If you're wondering how a diabetes drug relates to a respiratory virus like COVID, you're not alone. Dr. Carolyn Bramante is an assistant professor of internal medicine and pediatrics at the University of Minnesota Medical School. She's also the lead investigator of the study.
It's very confusing too. We have had people ask, well, if metformin might reduce severity, why is diabetes, such a big risk for poor outcomes from COVID, which is a great question. So, diabetes is in a state of chronic inflammation, type 2 diabetes, and high blood sugar. Both of those things, we think, appear to make the severity of COVID-19 disease worse.
She says metformin has also been effective in treating Zika and hepatitis C. It's even been used to enhance fertility. The drug has been FDA approved for decades. Kids have taken it, as have pregnant women.
It's clearly easier to study something that has already been used in pregnant people because you have, data to fall back on in discussing in general the risks of using that medication in pregnancy.
Dr. Sarah Cross is a high-risk obstetrician and assistant professor at the University of Minnesota Medical School. Pregnant women are generally excluded from drug trials, COVID or otherwise. Dr. Cross says that can be risky.
Because then you don't really know how something works in pregnancy. So if you don't have any data, then every time you talk to somebody, you say, well, you have this medical condition, you have high blood pressure, and I'd like to give you this medication, but it's never been studied in pregnancy, so I don't really know.
Researchers hope people, including those who are pregnant, will enroll in this trial. Even with the vaccine coming out, Dr. Bramante says metformin is an available and inexpensive treatment that could improve survivability, but they need the study and those 570 people to prove it. It's a simple sign up, and doctors say a safe drug.
This would be people who were recently diagnosed with SARS-CoV-2. They don't have to have symptoms, but they have to have had a positive test within 3 days.
If you're interested, head over to covidout.com. I'm Stephanie Stone, reporting.
It's not just students making their way every which way across the campus of Bowling Green State University.
I never would have thought that this would be a thing that we'd be able to see.
The school was one of the first universities in the country to offer robot food delivery service to students and staff. The little robots go about 4 miles an hour and can operate through rain and snow, carrying everything from pizzas and drinks to groceries. More than a dozen sensors and GPS help guide their paths.
Also with the mapping process, they are told where's a safe place to go and where's not a safe place to go, so they can only cross at certain crosswalks.
An app lets students pay, and you order from a variety of restaurants, and it delivers right to dorm rooms or apartments.
Sometimes it's really funny to laugh at them because they get stuck or they just sit there and stare at each other.
The program has been in the works for years and launched right before the pandemic hit, as everyone on campus started hunkering down. The university is now up to 65 delivery robots zigzagging their way around campus, making an average of 1,000 deliveries a day.
Well, we know today is about the sunshine. Tomorrow you've got the warmth, and then the buzzkill is Wednesday. Cold front's coming our way, guys, and it is going to have a big impact on temperatures later on this week. So until then, we're dry, but Tuesday night, we will be looking at the return of showers and a few thunderstorms, probably some good soakers out of this system, too. So this is going to be arriving around midnight and going into early Wednesday morning. Notice it's kind of east of the I-71-75 corridor that we should see some of those heavier showers as the cold front continues to do some lifting there in the early morning hours. A lot of Wednesday doesn't look all that rainy, but it will be cloudy and turning colder. Wednesday's high only ends up at the 50-degree mark, and then Thursday we end up at 40. A meager 40 degrees on opening day, but it will also be windy with a northwest wind at 15 to 20 miles per hour, so that means it's going to feel even colder all day long. Temperatures, though, will rebound for the weekend ahead.
Millions of Americans have found themselves unemployed during this pandemic. Many have been able to find jobs, but there are plenty of other people who have spent months trying to find work. In cities and towns from coast to coast, there are countless Americans still looking for work.
It's very humbling. I've had to turn to resources that I'd never turned to before.
Leslie Schwimmer is among the millions who lost her job at the start of the pandemic.
I tried to downsize and reduce my expenses as much as I can.
Leslie owned a spa in Ventura, Florida. When the pandemic hit, though, she was forced to close. She was eventually able to reopen, but by then the damage had been done.
Gut-wrenching, beyond gut-wrenching. I put my life into it. Sold my house, gave, all of my everything. I put into that, and it would just, I never thought it was an option not to succeed.
This single mother of 3 suddenly found herself looking for work. That was back in September. 7 months later, this 57-year-old still can't find a job.
Do you think your age is the biggest thing that's keeping you from getting a job right now?
I think so. I think so. I think that, you know, I tried when I went to different resources to mask my age as much as I can.
Nationwide, the unemployment rate is sitting around 6.2%. The number of long-term unemployed, or people who have been jobless for at least 27 weeks, is right around 4.1 million. Half of those people, though, about 2 million, are over the age of 55.
I do think that age is a huge factor.
Nearly a year into Leslie's job search, answering that question, how are you doing, isn't easy.
Frustrating, tiring,
humiliating. I hate that one, but it's hard on your self-confidence. I find it very hard.
But from LinkedIn to old-fashioned networking, Leslie is determined to find work and find her way out of those unemployment statistics.
I've gotten past 2-3 interviews now, and they've shown some real interest, but no job offer as of yet.
In South Florida, I'm Chris Conti.
It's a mini grocery store and food truck combined in one.
A food bank in South Florida is rolling out a new program to get healthy food into communities that need it most. They created this grocery store on wheels. The truck includes fresh vegetables, a refrigerated section, and meat products. It will visit low-income communities that lack access to fresh food.
People should have access to food, affordable food, even if they're on food stamps.
22 tons of donated food was given out in the last year.
A pop-up food pantry in Detroit is going strong while people still need help during the pandemic. It started as a temporary resource that's turned into a nonprofit helping thousands of families. Last year, they provided 11,000 neighbors with food and essentials. They also keep several mini pantries stocked throughout the neighborhoods.
We want to make sure that people don't have to make the choice between paying rent and feeding themselves and their families.
You've heard of little free libraries. Now one Denver nonprofit took the concept and applied it to people looking for something to eat. They created a community fridge that's hosted by the community and maintained for the community.
If you need stuff, you just go and pick out whatever you like and take it home with you. It's really that simple.